Thommen Medical implants with a regular collar, also known as RC, feature a hybrid design that combines a rough, acid-etched surface with a smooth 1 mm collar, known as the TISSUEGUARD collar. These implants utilize a butt joint connection that keeps the microgap vertically positioned above the bone. When it comes to placement depth, Thommen Medical RC implants may be considered bone-level implants with an added safety zone. To ensure healthy and stable outcomes, the placement depth of RC collar implants should consider the available soft tissue above the alveolar bone and follow a prosthetic-driven approach. In the anterior region, a recommended distance of 3 to 4 millimeters should be maintained between the implant shoulder and the lowest point of the expected soft tissue margin. In the posterior region, a 2 to 3 millimeter distance is generally advised. Notably, supracrestal placement without considering the future prosthetics can complicate the formation of a functional emergence profile, which is essential for proper hygiene maintenance. By adopting a prosthetic-driven approach, these complications can be avoided, ensuring a more functional and cleanable result. When placing an implant subcrestally, excess bone around the implant shoulder may prevent the microgap from closing tightly, potentially compromising the mechanical and biological function of the implant. Subcrestal placement may also lead to crestal bone compression around the collar region. Therefore, the profile drill must be used during implant bed preparation. To ensure sufficient space for the provisional restoration and, even more importantly, for the future final prosthetic restoration, any remaining excess bone should be removed during the surgical phase. For this purpose, Thommen Medical offers a dedicated bone contouring instrument designed to precisely remove excess crestal bone and optimize the implant prosthetic fit. It is important to understand that subcrestal placement of RC implants triggers a natural bone remodeling process in the period following implantation. With bone levels stabilizing around the smooth, rough border, this process is a natural part of healing and not to be confused with bone loss due to infection. The ultimate goal is to ensure that once the healing process is complete, the soft tissue is only in contact with the smooth surface, minimizing the risk of infections and bone loss. Clinical data, like those from the study by Molinaro-Morel published in 2024, demonstrate this process of bone remodeling, with stable bone levels above the smooth, rough border observed after an average follow-up of 9 years and 7 months. Several other studies, including real-world data, also confirm stable bone levels around the smooth, rough border over the long term. This is made possible by the established TISSUEGUARD safety zone at the crestal level, combined with the particularly tight microgap of the EverGuard connection. By adhering to the recommendation of adopting a prosthetic-driven mindset during placement, the conditions are set for stable bone levels, healthy soft tissue, and optimal cleanability, all of which contribute to the long-term success of the implant. For more information on clinical evidence, please visit the Science Hub on our website.